Hi, I'm Dr. Shaina, and today we're going to talk about overuse injuries in dancers. So what is an overuse injury? It's not necessarily that you rolled your ankle once and you hurt something, or you fell on your knee and you hurt something. That's more traumatic. Overuse is when you do something a little bit more consistently. Maybe it didn't bother you before, but then something starts showing up when you do that activity. You keep using it more and more, overuse in a sense, and then it gets overloaded or so. Things like tendinitis can be overuse. Things like muscle overuse sometimes can present in spasms if your body becomes sensitized. And what can lead to overuse? So things like dancers have a lot of hypermobility depending on the type of dance that you do. So sometimes when you're weak and you lack control, that's how you can get overuse injuries, and sometimes things will spasm or you'll just overload something and your muscles kind of seize up to protect it. Other ways you can overuse, you might have a certain track that you're doing. Let's say Broadway performers, they perform the same show 6 days a week, sometimes the same track, unless you're the swing, 6 days a week of the same track over and over and over, the same things over and over and over. Maybe the first 100 times it doesn't bother you so much, but then you get to the 500th show and it starts presenting more and more and more. That's going to be part of your overuse issues. Parts of the ways that you can prevent that overuse. So think of what you do during your rehearsal or what you're doing, let's say, in the show. So how can you prevent overuse? Sometimes training is really important, especially if you're hypermobile and you don't have that strength and control. Then you need to spend time outside of your art to do that training. Strengthening, stabilization, sometimes people do Pilates, sometimes people do personal training, strength and conditioning. Maybe some people might even do weightlifting. That's going to actually train your body so that you can support the art and the movement that you do, no matter how much you do it. That, along with afterwards, think of what you do in that session. How do you undo what that role does for you, or does to you? How do you undo what your part or where your rehearsals or what your show does to you? You're overusing or moving in certain ways, but it's not necessarily all around balance and encompassing. So let's say you have a lot of hamstring use in something. Maybe you want to stretch your hamstrings after. Every role and every character is going to be a little bit different. Every dance style is going to be a little different. How do you tell it's more of an overuse pain rather than, let's say, muscle pain just from working out? And so when you're working out, you feel your muscles working, you feel that burning pain. Some people call it pain, some people feel like it's just muscle work. More so, it might depend on the location that you're having that pain. Such as if you're doing, let's say, split squats, or if you're doing plies and you're feeling your buttocks working and your quads working and your hamstrings working, that's not necessarily overuse. But then if you start feeling kind of the connection, like the tendons where the muscle attaches to the bone or within the joint, you don't necessarily want to have joint pain or ligamentous or tendon type pains when you're doing these exercises. You want to feel it in your muscles a little bit more, especially when you're strength training. And so if you start seeing swelling or sharp pains or any other types of inflammatory conditions, then that might be a time to get it checked out. Thank you for watching this video. I hope I answered some of your questions. Now remember, all of you might be a little different. All of the dance styles are different, all of the rehearsals and the shows are different. So if you have any extra questions, feel free to reach out. Check us out at www.healthfitinc.com or give us a call. But reach out if you need us. We're here for you.